Destination Medicine is a collaborative initiative of regional training hubs. With first-hand lessons learned from those who have gone before, this podcast is designed to assist and inspire anyone interested in pursuing a medical career in rural and regional Australia. Welcome to Destination Medicine. I'm Peter Letts. Growing up in a family of healthcare professionals, Dr. Aiveen Bannan initially thought she'd choose a different path. But after a hospital work experience placement in Year 11, she discovered a deep interest in medicine, and from there developed a passion for infectious diseases while studying microbiology and tuberculosis in medical school. After training in Sydney and becoming an infectious diseases physician, Aiveen chose to build her career in Port Macquarie, where she spent nearly 20 years caring for patients, leading infectious disease services, and teaching future doctors through the University of New South Wales. Along the way, she's combined clinical medicine with public health, medical education, and a deep commitment to regional healthcare. Aiveen begins by explaining why, despite growing up surrounded by doctors, medicine wasn't always the career she imagined for herself.
There's a lot of medical practitioners in my family, and as a child growing up, I'd initially thought that I would not go into medicine. My father is a doctor and my mum a pharmacist, and lots of medical people in the family. However, I did work experience in Year 11 at a hospital, and I really enjoyed the experience of being in the healthcare environment and multidisciplinary team approach to looking after patients. And so that set me on my path to study medicine. And I gained entry into the medical program as an undergraduate at the University of New South Wales, and really found that I enjoyed the program. I enjoyed learning about anatomy and physiology and pathology and the basic sciences, and then the clinical experience. So certainly felt like I'd found a place that I was comfortable in.
So tell me about your pathway from medical school to becoming an infectious disease physician.
So my interest in infectious diseases was probably sparked during medical school. I did a project in second year as part of microbiology on tuberculosis, and that really probably sparked my interest in infectious diseases. And then once I started working, I did a few terms through my training in infectious diseases, and I enjoyed the general nature of the problems that you encounter as an infectious diseases physician. And I also enjoyed the team approach. Often it comes down to finding your tribe, those people where you have similar interests and similar values. And I also enjoyed the public health aspects. So I have completed a Master's of Public Health along the way to further develop this. And the area of infectious diseases, many of them will also have a public health focus. So now, post-COVID, obviously people recognise that not only are you treating the patient, but you're also treating the community from a public health perspective and instigating those infection control measures, etc. And so I started on that pathway towards physician training, and then did my infectious diseases training once I'd passed my exams, which I did at Liverpool Hospital and Concord Hospital, and then spent a year in the Northern Territory in Darwin. And since then, completing my fellowship, I have worked in Port Macquarie as an infectious diseases physician, and found it to be a very rewarding field.
Now, you trained in metropolitan hospitals, but you chose to build your career in Port Macquarie. Why? What influenced that decision?
So through medical school and through my physician training, I was primarily based in Sydney. And there were lots of factors that fed into a decision to move to a regional centre, and Port Macquarie ticked a lot of boxes. So I had experience here in Port Macquarie as a student, but also as a physician trainee doing several rotations as a medical registrar through the hospital. And that meant that I had developed relationships with the local physicians and the local healthcare practitioners. Another reason for that decision was that there was availability and opportunity of positions for both myself and my husband, who's also a clinician. And There is a University of New South Wales medical school, and I wanted to be engaged in teaching. It was not that far from Sydney, where my family is based, and there's also an airport, which meant that you could fly, if necessary, to conferences or to Sydney to visit family. So certainly now I've been in Port Macquarie for almost 20 years, and I've had a very rewarding career, and really enjoyed being in a regional centre where you have those close relationships with colleagues, and also get to really help the community, particularly when there's lack of services in regional areas.
What is it that you enjoy most about infectious diseases, and why has it remained so rewarding throughout your career? I can hear that you're passionate about it. As we're talking, I can get that sense. Why is it such a passion for you?
Well, you really see a huge variety of conditions, and they present in lots of different ways. You're always navigating the interaction between microorganisms and the individual patient and their, susceptibility to infection, and then factoring in what treatment is appropriate for that individual. So there's a lot of variety. It's a very collaborative specialty, which is something that I really enjoy, working with a team of the infection control nurses, the pharmacists, trying to manage appropriate antimicrobial prescribing. Infectious diseases is a very consultative specialty, so we're often providing advice to other specialists or general practitioners. Often I'm working with the surgeons because the patient might have a complex joint infection with a prosthetic joint in situ, so a joint replacement that becomes infected. So then you're working not only with the orthopaedic surgeons and the infection control team and the pharmacists about what's the most appropriate antibiotic, the microbiologists, and the allied health clinicians, so occupational therapists, physios, social workers. So it's a real multidisciplinary team approach, and I enjoy that. It's also a great community to be part of. There's a lot of generosity within the infectious diseases community in terms of collegiality and providing advice and assisting others who have challenging cases or difficult circumstances. And that certainly was brought out during the COVID pandemic for all infectious diseases physicians and microbiologists and epidemiologists and public health physicians. It was certainly a very intense, busy time. And one of the strengths of that community is that we were all able to work together and to try and provide, guidance to the community through that very difficult time. So, there are a few of the things that I enjoy about this particular field in medicine.
Aiveen, for many years, you were the only infectious diseases physician in the region. What was that experience like?
Yes, so I have been in Port Macquarie now for almost 20 years, and until last year I was the sole infectious diseases physician in the region. So that's quite challenging when you don't have colleagues to discuss patients with or to get advice from who are down the hall or across the corridor. And I think that forced me to build networks with colleagues further afield. So particularly at John Hunter Hospital in Newcastle, which is the nearest large centre where they have a Department of Infectious Diseases, and they've always been incredibly supportive of me in a smaller centre and always happy to provide advice. And the other thing that I was very conscious of was being part of the Australasian Society for Infectious Diseases. They have an annual conference, and I made a point of getting to that pretty much every year just to make sure that I was keeping up to date and networking with my colleagues and having professional development. And I think, again, post-COVID, that's become a little bit easier in that a lot of meetings now are online and are virtual. And so it's easier to link into case presentations or discussions or meetings that might be on, distant to where I am. And that's fantastic to be able to have that facility to dial into those discussions. So over the years, I feel like I've built that network, and Obviously, over the years, clinically, things have got busier for me. And so it's really wonderful now to have a colleague who's sharing that clinical load with me. And we alternate the on-call, which is fantastic. And, it'll just get busier in the future as the population expands and patients have more complex medical backgrounds and therefore are more at risk of infections, etc. So, certainly that's happened over the last 20 years, and I imagine that will just continue to happen over time.
What's kept you and your family in Port Macquarie for nearly 20 years?
We've been able to live near the beach and make the most of all the benefits of living beside the sea. Lots of natural beauty in a place like Port Macquarie where you can go for bushwalks and swims, and the hinterland is not far away. So there's a lot of benefits to being in this community. I think the children have had, one of my friends calls it a free range upbringing, where they were able to be independent, get on their bikes and go and visit their friends around the corner, walk home from school, catch the bus themselves, which is maybe more difficult in a metropolitan setting where there's more traffic and it's busier and the distances are further for them to get to their friend's house. And like any regional centre, the other benefit is being close to everything. So, doesn't take too long to go from home to work. So even if you need to go into work to see a few patients on a Saturday or do a ward round, it'll only take you 15 minutes to get there and 15 minutes to get home. So, that's a huge advantage, I think, to being in a major metropolitan centre where travel is a time-consuming factor in your day. So we've enjoyed our time in Port Macquarie, and I think now the kids are at an age where they're making their own pathways, but we're certainly enjoying being based in a regional centre.
Aiveen, you've also built a significant career in medical education through University of New South Wales. How did that opportunity evolve?
Well, I think for most doctors, teaching is part of our role as clinicians. And certainly, even as a medical student, you become engaged in teaching the junior students when you're a more senior student. And certainly as a junior doctor, you become involved in teaching medical students. And so throughout my career, I've been involved in teaching. And when I moved to Port Macquarie, that was something I just continued. And so I've been teaching and involved in the program at UNSW for the last 20 years since we moved here. And I've had a progression through that at being a lead in many of the different phases of the program and various modules within the program. And the opportunity came up 2 years ago for a role as the co-medical director of education, and I applied for and was successful, and that's been certainly interesting. It's a challenging pathway to oversee a medical program and being, a supervisor for students across years 1 to 6, but also being involved with staffing and programming. The University of New South Wales is also undertaking a redesign currently, and so the new medical program starts in 2027 and will be slowly phased in over the next couple of years. So there's been a lot of change, but it's always fantastic to be involved in teaching the students because the students always keep you on your toes. So you learn lots from them. They're engaged, they're enthusiastic, and they're also very passionate about learning and gaining knowledge so that they can be equipped to be the doctors of tomorrow. So, it's a really rewarding part of my professional life. And I think for most doctors, we do see part of our role as supporting, supervising and mentoring future clinicians.
If you look back, who or what do you think has influenced your career most?
Yes, look, I think there's numerous people who've been role models and who've encouraged me and guided me. I think certainly senior female physicians throughout my training. There's infectious diseases has quite a significant proportion of female physicians, probably more so than other areas of specialty. And I think that certainly provides an inspiration, because you can see that there is a role for you as a female physician, and that you can forge a path and take on leadership positions and balance that with family life. So I think that's really important across the board, not just in medicine, but just in general, that, you can imagine who you can see. It's very hard to imagine if you can't see someone like you in a senior position or a leadership position. So that's, probably what's influenced me. And the things that I value when I look for role models is people who display those attributes of professionalism, collaboration, and compassion for their patients. And I think, there's lots of examples with that, not just within the infectious diseases community, but in general. So if we look at someone like Professor Richard Scolyer, who died recently, the influence and the impact that he's had, and there's lots of people like that in medicine who really want to give back to the community and do the best that they can for their patients, and either achieve that through clinical care or through research, leadership positions. And, I think that's something that can inspire us all.
Well, as we wrap up, as you know, medicine can be incredibly rewarding, but also really demanding. How do you maintain balance and avoid burnout?
What's important is having breaks and having holidays, and particularly having holidays where you can switch off. So up until a few years ago, whenever I went away, I didn't really get away. It meant that people were still phoning me and calling me, and I was still providing advice, even though I wasn't necessarily on site. And that means that you don't ever really fully relax. So it's important to take breaks, but I think it's also important to have regular activities with social connections and exercise, and seek out support of colleagues as well. I think discussing difficult cases with your peers is very valuable and really helpful, and a lot of that has changed, over my career. Certainly there seems to be now a focus on, having conversations with colleagues about, challenging patients, about difficult situations, about what's the best path to treat someone and how to manage them. And certainly that's become very collaborative, and I think that helps. So, all the usual things like getting enough sleep, eating well, exercising. I think being out in nature is really critical to your mental well-being for all of us. So those sort of things, trying to build them into your everyday is really important. Yeah, and being grateful, I think, is another thing that's really important. Often we can get caught up in the busyness of day to day, but it's actually really important to recognise that we're just very fortunate, and to count your blessings while you can, even more so as I get older, and, particularly when there's unexpected tragedies. I've recently lost friends unexpectedly and colleagues, and I think that really makes you reassess what you do have, and to be grateful for what you do have, and to try not get overwhelmed with the clinical demands, because that's difficult. It's a difficult balance to strike. And I think it's important to not be fully consumed by it and have that balance.
Dr. Aiveen Bannan, infectious diseases physician at Port Macquarie Base Hospital in New South Wales. This is Destination Medicine. Thanks for listening. Regional training hubs are supported by funding from the Australian Government under the Rural Health Multidisciplinary Training Program.